My name is Kayla Dowler, and I will be doing special tests of the lower leg. The first test is the pause compression test, and I will squeeze the tibia and fibula together while observing her face and asking if there is any pain while moving down the leg. A positive test would indicate a fracture, and it would be by pain at the fracture site. The next test is the long bone compression test, and I'm going to be looking at her fourth metatarsal, and I am going to stabilize the bone and then compress down while seeing if there is pain at the fracture site. The next test is the vibration test. I am using a pencil as my tuning fork, and you first start it off by vibrating or hitting the tuning fork to make it vibrate, and then place it above where the pain is. See if there's any. I ask her if there's pain. Pain would be indicated and indicate a fracture. I will then move to the percussion test or the heel bump test, and I will put the patient's foot at 90 degrees, and then I will bump the bottom of the heel. If there is pain, that would be indicating a fracture. The next test I'm going to perform is the anterior drawer test, and I'm going to stabilize the tibia and fibula from above with one hand, and then the other hand I'm going to move the talus up and down or up to see, and I'm going to compare both sides because a positive test will be indicated by laxity compared to the uninvolved side. The next test I'm going to perform is the talar tilt test, and this also is indicated by laxity, so compared to the uninvolved side, so I will be doing it on both sides, but I will first move the ankle into a 90-degree position and then tilt it into adduction and abduction. I will then do the dorsiflexion maneuver test, where I will passively move the ankle into dorsiflexion, and a positive test would be a report of pain. So I asked her if she felt pain over the front of her ankle. The next test I'm performing is the Kliger test, and I'm going to move the test and I'm going to rotate it into external and internal rotation. And I'm going to compare both sides because a positive test is laxity compared to the uninvolved. I will then perform the squeeze test of the leg, and I'm going to have my patient lay face down, and I'm going to squeeze her calf, and I'm going to see if there is pain over the front of her ankle. And then I will perform the Thompson test, where I grab her midpoint of her calf with one palm and see if there is plantar flexion. If there isn't, that would indicate a positive test for an Achilles tear. And now I'm going to perform the Maltese test, where I'm going to have my patient actively flex their knees to 90 degrees, and I'm going to be looking to see if the foot falls into neutral or dorsiflexion, which would indicate an Achilles tendon rupture.